Hey everybody, happy Wednesday, Wellness Wednesday at Greystone Chiropractic. It's Lee, live with Lee on Wednesday, coming from Greystone Chiropractic, your family wellness chiropractor. Wanted to talk about pregnancy today. Everybody loves talking about that, right? One of the things people ask me a lot is, why do you see people when they're pregnant? Or you can do that? People are surprised that people get adjusted when they're pregnant. And it is a really important time to make sure that the structure is as adaptable as possible and in optimal fashion, because the alignment really affects the room in the womb for baby to grow, but it also keeps control of nervous system connection from the brain to the hormone control to all the nerves that deal with digestion and nourishment to the baby, signaling to and from the brain from mom and to the baby. So it's really crucial and vital to make sure when you're pregnant you're getting adjusted. Now, I wouldn't just go anywhere, of course I'd come here, or to another really great family wellness chiropractor. So if you don't know one and you're not close by, let me know and I'll try to help you find somebody. One of the ways that we can evaluate in our office is to use a pillow like this, because a lot of times people feel like, well, I can't lay down, how am I supposed to get adjusted? I can't lay on my stomach. Well, this pillow actually has a nice indentation. So a mom with a baby in here can actually lay right on it, and it'll take pressure off of that so you don't feel like constriction or pressure on the womb. The other thing is the table itself that I have you lay on drops down about 6 to 8 inches, so it takes pressure off that spot. So you can actually lay face down for the first time maybe in months, and it's quite actually comfortable from what I hear. I haven't been pregnant, but for those of the patients that are or have been and come here, they tell me that it is really comfortable, and they don't want to get up usually after. So what's the really important thing and a vital understanding about chiropractic care and pregnancy, or anything if you really want to look at it? If you're looking at the spine, you know there's nerves on every level, both sides. There's 31 pairs of nerves that are connected to the spinal cord, which is running inside of the spine. That spinal cord is connected to the brain. The brain, in order for it to send a signal, has to go all the way through the spinal cord and out nerves to signal your cells, your organs, your tissues, all the body systems and functions. So if there is a subluxation or a misalignment that's affecting the communication or the opening of that nerve pathway, it's going to affect not only the signal from the brain to the organ or the cell or the tissue, but it's also going to block the communication back up, which is called afferent communication, back up to the brain, and affect the way your body is recognizing, or your brain is recognizing what's going on in the body. So it's a really communication error. So even if I feel it in my rear end or in my big toe or my leg, there's some connection from the nerves that control that affecting your brain, or your brain affecting it in a bad way. So we really want to take close and careful care of that. And the way we look at that is in a special leg check analysis, a nervous system analysis. On our first day, we measure temperature around the spine to see where there's irritation or inflammation to nerves. And I can do other kinds of checks when you're on the table, when you're getting adjusted, that maybe wouldn't require me to look at x-ray, because obviously you can't x-ray somebody when they're pregnant. So I'm able to analyze it in a different way until I can actually get x-rays after the baby's born. So there's many different ways to do it. There's ways to use hands to adjust. There's ways to use the adjusting tool. You can see this thing has many different attachments. This is for babies. This is for kids or adults. I have several others there in that rack you can see behind me. And those help me not only adjust, but actually start to re-communicate with those receptors around the joints, and helps everything realign right and communicate better around to the brain, from body to brain. So hopefully that sheds some light on how we do chiropractic care with pregnant moms, and also really with anybody who has a spine and nervous system, which really needs regular care and maintenance, just like your teeth. So I'm excited to work with you. I'm your family wellness chiropractor, Dr. Lee, and I will see you in the office soon. If you need us, call us, 205-981-8090. And let me freeze that. You do need us, so call us, 981-8090.